discuss the hip bone. Hip bone is a flat, irregular bone which is situated in the pelvic region. It is homologous to scapula of the upper limb. So let's discuss the hip bone. Hip bone is divided into the three parts. Ilium, this part is known as the ilium part. This is pubis and this is ischium. Ilium, pubis and ischium. These are the three parts of the hip bone. They are joined at the point known as the acetabulum, where acetabulum is formed by the ilium, ischium and pubis. The out of 5 parts, ischium part form 2 parts, ischium 2 parts and pubis 1 parts. So they are meeting a Y-shaped structure at the acetabulum, that is ilium, ischium and pubis. Side determination of hip bone. The hip bone, this part is known as the anterior superior iliac spine and this part is known as the pubic tubercle. They lies in the one plane. This lies in the one plane. Okay. This ilium which expanded and upper part, which form expanded and upper part, whereas the acetabulum, this acetabulum cavity is directed laterally. This acetabulum is directed laterally and obturator foramina, this obturator foramina which present below. Okay. So according to this hip bone is belong to right side. This hip bone is belong to right side. Ilium contain 3 borders and 3 surfaces. Ilium contain 3 borders and 3 surfaces and 2 ends. This is the anterior end, is known as the anterior superior iliac spine, and the posterior end is known as the posterior superior iliac spine. In between that, iliac crest is present. In between that, iliac crest is present. The iliac crest is having 2 borders, that is the inner border and outer border. Inner border and outer border, and in between that the area is intermediate area is present. Okay. Now this iliac crest is divided into 2 parts, ventral 2/3 and dorsal 1/3. Highest point of iliac crest is lies at the level of L3 and L4. Okay. Now come to the ilium. Ilium contains 3 borders and 3 surfaces. First borders, this is the anterior border which are present from the anterior superior iliac spine and anterior inferior iliac spine, anterior superior iliac spine, anterior inferior iliac spine. This is the anterior border of the ilium. This is posterior superior iliac spine and this is posterior inferior iliac spine. This is posterior superior iliac spine and this is posterior inferior iliac spine. So from this posterior border is formed. From where posterior border is formed, which directed downward along with the greater sciatic notch. This is the greater sciatic notch. This is the ischial spine and this is the lesser sciatic notch. Greater sciatic notch, ischial spine and lesser sciatic notch. This all from the posterior border of the ilium. This is the medial border. It is a medial border. This is the medial border. Now come to the surfaces. This is the gluteal surfaces. This is gluteal surface which divide into the 4 parts by the 3 lines. This is the inferior gluteal line. This is anterior gluteal line and this is posterior gluteal line. From where this divide into the 4 parts. Okay. This is the iliac fossa. This surface is known as the iliac fossa or iliac surface. This is known as the sacroiliac or sacropelvic surface. This is known as the sacropelvic surface. The iliac fossa and sacropelvic surface are separated by a medial border. This border is the medial border. Okay. Sacropelvic surface which contain the tuberosity. This tuberosity is known as the iliac tuberosity. This tuberosity is known as the iliac tuberosity, and where is the auricular part is present. This auricular part is articulate with the sacrum which articulate with the sacrum and form sacropelvic surface, and just below that auricular part, this part or this surface is known as the pelvic surface. It is smooth. This surface is a smooth. This is known as the pelvic surface. Okay. So this part is the pubis, which contain three surfaces. The three surfaces are, this is the anterior surface. Anterior surface is rough. This is the posterior surface, or also known as the pelvic surface. This is the posterior surface, or also known as the pelvic surface. And medial surface, or also known as the symphysis surface. The symphysis, which articulate with the another symphysis surface of the hip bone and form the pubic symphysis. This pubic symphysis joint is secondary cartilaginous joint. It is secondary cartilaginous joint. This is the pubic symphysis. This tubercle is known as the pubic tubercle. This tubercle is known as the pubic tubercle, and a sharp line is known as the pecten line. This sharp line is known as the pecten line. This whole surface or whole part is known as the superior ramus. This whole part is known as the superior ramus, and it is triangular in shape. And this part is known as the inferior ramus. This part is known as the inferior ramus, is joined along with the ischiopubic ramus. This is the inferior ramus, superior ramus, and body of the pubis. This is the body of the pubis. So this part is known as the ischium. This part is known as the ischium. Ischium is contain three borders and three surfaces. The posterior border is related to the posterior border of the ilium. Posterior border is related to the posterior border of ilium and ischium. These are same. That is known as the lateral border. This border is known as the lateral border. Anterior border, posterior border, and lateral border. Come to the three surfaces. This is the pelvic surface. This is known as the pelvic surface of ischium. This surface is known as the femoral surface of the ischium. Pelvic surface of the ischium is smooth. This is the femoral surface, and behind, along with the gluteal region, this surface is known as the dorsal surface. This surface is known as the dorsal surface. This is the ischial tuberosity. This ischial tuberosity is divided into the two parts by a transverse line, upper half and lower half. Then again, upper half is divided into the two parts by an oblique line. This is the superolateral surface, and this is inferomedial surface. And lower part is divided into the two parts by a transverse line, that is the inner part and outer part. This is the ischial tuberosity. This is overall the obturator foramina. This obturator foramina is covered by the obturator membrane. In case of male, it is large and oval in shape. In case of female, it is small and triangular in shape. It is acetabulum. This acetabulum is contain a articular part. Is known as the lunate. This articular part is known as the lunate, where is the gap towards the obturator foramina is known as the acetabulum notch. This is known as the acetabulum notch. And the non-articulating part at the center is known as the acetabular fossa. This is known as the acetabular fossa, where all three parts, ischium, ilium, and pubis, is form Y-shaped structures, which form a Y-shaped structure in the acetabulum cavity. Hip bone contain 3 primary ossification and 5 secondary ossification. 3 primary ossification, 1 for the ilium, 1 for the pubis, and 1 for the ischium, and 5 secondary ossification center, 2 for the iliac crest, 1 for the ischial tuberosity, and 2 for the acetabulum cavity. So hip bone contain 3 primary ossification center and 5 secondary ossification center. So next part of the hip bone we will cover in the next video. Thank you very much.